Thanks so much for popping in and joining us today. We're putting a video together to talk about heart attacks and what is the main difference between a heart attack and a sudden cardiac arrest. So first, let's start with heart attack. A heart attack is a plumbing issue in which the heart is not receiving efficient amounts of blood flow or oxygen-rich blood, and it slowly begins to weaken and not function 100%, right? So this is what we would consider a heart attack, whereas a cardiac arrest is an electrical issue in the heart. So the heart's electrical system is abnormal, it's chaotic, it could be rapid, and we have basically a complete stoppage of function of the heart. So when we're seeing heart attack, we're looking for chest pain or shoulder and jaw to shoulder radiating pain, changes in levels of consciousness, shortness of breath, sometimes even feelings of anxiety or the onset of it happening can be present. And it's also really important to understand how this affects biological men and biological women differently. So biological men will typically experience those common symptoms that we kind of just mentioned, whereas biological women can experience maybe a mild version of those. But on top of that, nausea, diarrhea, vomiting, things like that can also persist in biological women. So it is important to kind of take a note of that and understand how that could possibly present different based on the individual. In any case, the important steps to follow here is obviously we want to call 911 right away. This is a life-threatening emergency. A heart attack can worsen and progress and transition now into a sudden cardiac arrest, in which now the heart has completely stopped functioning, where we would have to administer CPR and use an AED machine if one's available. So again, we do want to monitor that person. We ideally want them sitting on the floor. Sometimes usually what we tell people is, tuck the knees, sit, kind of rest forward, try to stay calm. If they're wearing tight clothing, maybe trying to loosen that clothing would be a good idea. And we're going to call 911. Grab the AED machine to be proactive here and just kind of monitor the person's breathing and their responsiveness until advanced support arrives, or if for any reason they go unresponsive and stop breathing, administer CPR. So hopefully you guys enjoyed today's video, understanding the difference here between what a heart attack is and a cardiac arrest and how we care for a heart attack. Thanks.